We are back with Lauren Evans from Med Center Mebane. So we are talking all things breast cancer and we're talking things mammography. And let's talk about this. What kind of changes in your breast should women be looking for that they need to really go talk to their doctor about?
If you were to notice anything like skin or nipple discoloration, any kind of itching or dimpling in your breast, nipple inversion, any kind of lump, pain, or any kind of discharge, you would definitely want to get that looked at by your doctor to see if you needed further testing done.
And that's not a, hey, let me see if it'll go away. This is, if you've seen it for like a week, you need to know that you need to go see the doctor.
That's correct.
Okay. All right. So in addition to getting the yearly screening mammogram, which we talked about at age 40, and contacting your provider about any changes, what kind of steps can all women do to help reduce their risk of breast cancer?
So the best things that we can do would be to maintain a healthy weight. You would want to exercise, no tobacco use, and limit alcohol use.
All right, and so that's just kind of like the basic healthy diet kind of thing, healthy living kind of thing.
Yes.
Let's talk about this because sometimes we hear this often. Sometimes women have to get a second mammogram because they're told, oh, you have dense breast tissue. What does that mean and how does it change a risk in breast cancer?
So breasts are made of fat and fibroglandular breast tissue. The fibroglandular breast tissue is where you would see the dense tissue. So it can increase your risk of having breast cancer. And around, I would say 50% of US women have dense breasts.
All right, and so when you hear those words together, dense breast tissue, I think people think, oh, those are people with larger breasts, or those are people that are older, or those are whatever. What does it have to do with?
So that is just your makeup, your body's makeup. That is not necessarily something that, and it's not something that you're going to see unless you have your mammogram done. So it's very important to have your mammogram done for that reason.
Okay, and so with dense breast tissues, sometimes the mammogram, you have to do like a 3D mammogram or something like that to be able to see that dense breast tissue.
That's correct, Tanya. So we do the 3D mammogram. We do that as a screening, but also as a diagnostic. And that is definitely the best option that we have for dense breast tissue.
All right, and that is kind of like it's a non-negotiable. If you have dense breast tissue, every time you go to get your mammogram, you really need to get that because that's really the only way it's going to be seen.
That's correct.
Okay. All right. So let's talk about this. A common misconception about breast cancer that you want to set the record straight on.
So most breast cancers that are diagnosed in women who don't have symptoms. So a lot of people feel like if they don't notice any problems, then they don't need to worry about having a mammogram. But it is quite the opposite of that. You definitely need to have a mammogram because we could catch it at its earliest stage. And there are more treatment options the earlier that it is caught.
And this is one of those cancers where early detection really is key.
Yes, you want to catch it as early as possible so you have better treatment options.
And just to think that 6,000 women in North Carolina are going to be diagnosed this year. Let's just talk about some final thoughts about mammograms, breast cancer, what you want people to walk away with today.
So my biggest thing is just making sure that everyone is scheduling their mammogram. It's very important to get that scheduled. Just go ahead and get it on the books, and that way it's already there. It takes just a few minutes to come in and get it done. Usually maybe somewhere between 5 and 10 minutes, so it doesn't take much time out of your day. So go ahead and get that on the schedule, and also you can learn more about it at conehealth.com/mammograms.
And a few quick things, no deodorant that day, no lotion that day, right?
That's correct. And also try to remember to wear a two-piece outfit so you can just remove your top, put on our gown, and it's just easier that way.
And it really only takes, I would say, like maybe 10 minutes.
That's correct, Tina. Right. It's really quick.
Yep. So go get it. Get that screening. Thank you so much for your time and expertise. If you miss any of this, this is going to be in the 2-year well-being section of our website.